Hello, everyone. I'm Dr. Leslie Kernisan, board-certified geriatrician and the founder of the website betterhealthwhileaging.net. And this is the Better Health While Aging video podcast, where we discuss common health problems that affect people over age 60 and the best ways to prevent and manage those problems. We also often address common concerns and dilemmas that come up with aging parents and other older loved ones, like what to do if you're worried about falls or safety or memory, or even the quality of an older person's healthcare. So in this episode, I am going to talk about one of the top things that I do in my work as a geriatrician, which is help my older patients improve brain health and emotional well-being. Now, a big part of that work does involve helping older adults identify and stop medications that are slowing brain function and might even be accelerating cognitive decline. And if you want to know which medications to avoid, please see my 2 videos on this topic. I have 2 videos where I go into this in great depth. But of course, there is much more that we can and should do to help the brain be at its best in aging. So in this episode, I am going to go through my list of what I think is most important to focus on to improve brain health and brain function. But first, I want to start by saying a few words about what my goal is when it comes to brain health and aging. So why is promoting brain health so important? It seems obvious, but I think it can be worth it to just go over a few specific benefits that I have in mind when I think about this. So first is to help your brain function at its best right now. Don't we all want to feel as sharp and clear as we can so that we can sort of make the most out of our days, our weeks, and our life right now? So another reason would be to slow down what we call age-associated cognitive decline. And in a moment, I'll talk a little bit more about what's considered normal so that you understand what I mean by that. Then there's also, for me, a goal of preventing or delaying what we might call abnormal forms of cognitive impairment, of memory and thinking getting bad. And those often include things like neurodegenerative conditions, such as Alzheimer's disease and Lewy body disease. And another very common cause of abnormal cognitive impairment is something that we call cerebral small vessel disease. So this basically means anything that is causing dysfunction of the small blood vessels in the brain. So when people have a major stroke, that's affecting a large blood vessel in the brain. But those large blood vessels subdivide into lots and lots of small blood vessels. And those are the ones that ultimately bring blood and oxygen and nutrients to your brain cells. And they can easily become diseased or not be working well. So we call that cerebral small vessel disease, and that can lead to potentially vascular dementia. And then lastly, I think, we want to promote brain health because although cognitive decline, so for those people who do develop memory problems or thinking problems or otherwise changes, that's not incompatible with a good life. At the same time, in general, it makes life much easier if we can avoid it or minimize it. And it's often what people want for themselves. So those are what I think about in terms of the 4 reasons why I think it's so useful and important to promote brain health as we are getting older. Now, what exactly is the difference between age-associated cognitive decline, what's sometimes also called normal age-associated cognitive decline, and abnormal decline, or what we might call cognitive impairment? So first of all, what's normal? What's normal with aging is for the brain's neurons, so those are your nerve cells in your brain that do all your thinking, including your memory processes. What's normal with aging is for those cells to work less efficiently, but they are mostly still there and functional. And this working less efficiently as we get older is in a way the definition of aging. It's what happens to all our cells, all our organs, our bodies over time. Now, for some people, it happens more quickly. For other people, it happens less quickly. That's generally, partly your genetics, but also your lifestyle and other things that are affecting your body and cells. So it is quite common as people get older for things to work a little bit more slowly, memory and other thinking processes, but it should still be working. And if you want to learn more about, normal ways that memory and thinking change with aging, I have an article about that on Better Health While Aging. Whereas what would be abnormal cognitive impairment? So in abnormal cognitive impairment or cognitive decline, what's happening to the brain's neurons is that they are getting sick, they are majorly malfunctioning, and they eventually die. And actually what we know is that in most cases, by the time people have quite obvious symptoms of memory and thinking problems. And by obvious, I mean, detectable in conversation to me, not necessarily to family members or people who don't have a lot of experience. At that point, they have lost quite a lot of neurons, not just a few, but quite significant numbers of neurons. And if we do special MRIs on their brains, you can often see that there may have been significant shrinkage or other changes. So that would be abnormal. And there are several conditions that do cause this or accelerate this. Now, most of the time, the underlying cause is one of the more common causes. So neurodegenerative conditions such as Alzheimer's disease, I would say the most common neurodegenerative ones are Alzheimer's disease, Lewy body disease, and maybe frontotemporal dementia. And then other conditions can be that can cause this. There are less common neurodegenerative conditions. And then again, there's, the vascular, the things that affect the small blood vessels, the cerebral small vessel disease. And most of the time, the damage has started 10 to 20 years before memory and thinking symptoms are obvious. We now know that the changes associated with Alzheimer's, that's how early they start to become detectable in the brain. But the normal brain has many more neurons than is strictly necessary to do most daily life functions. So that's why even as neurons are getting sick and dying, usually the brain is able to compensate until things have gotten pretty bad. So that would be abnormal cognitive impairment. And if people have had enough difficulty with their memory and thinking that they are losing independence in daily life tasks, and also they've been evaluated and it's been checked to make sure that it's not delirium, which is worse than usual brain function in the context of a severe illness or bodily stressor, that often gets better after the illness or surgery is over. So we want to make sure it's not delirium, it's not another medical condition that can scramble the way the brain is functioning. But if there are these ongoing memory and thinking problems and they're bad enough that people have lost independence in daily life activities, things they used to be able to do, like their finances or, making a meal, that might qualify as clinical dementia. And then there are some people who are diagnosed with something called mild cognitive impairment. That generally means that on objective testing, they do not do as well on objective testing of memory or thinking as we would expect for their age and education, but it's not yet bad enough to interfere with that independence in daily life activities. And so if you want to learn more about the difference between mild cognitive impairment, Alzheimer's, dementia, how those terms interact, I have a video that's all about that I would recommend to you. But that's what I mean by abnormal cognitive impairment. And again, by the time we see significant memory and thinking problems, a lot of neurons have died. So this raises a couple questions, which is you may be wondering, well, how do I know what's happening in my own brain? I mean, I want to promote my brain health, but if these changes can be happening for years before, how do we know what's happening in our brain, especially if we are in our 70s, 80s, or 90s? And so the answer to this is that historically, it's actually been fairly hard to know exactly what's happening in our own brains. A lot of the more detailed testing is not routinely available at the doctor's office. So there has been a lot of work done, especially on Alzheimer's disease over the last several years. And we do now have special tests that can detect those earliest signs of Alzheimer's before there are symptoms, that can detect the extra amyloid protein in the brain through special imaging scans or through testing the fluid that is around the spine that we get through a spinal tap. And there are even now some blood biomarkers that are being studied. However, those aren't available routinely to people. Now, that is starting to change because, as you may have heard, there are some newer amyloid antibody medications or treatments, I should say, really. It's an IV infusion that are available for people who have very early Alzheimer's or mild cognitive impairment, due to Alzheimer's. And so the more detailed testing is starting to become available, but usually it's not really available. And those tests have been restricted to special research studies. So what I would say before going on with how to promote brain health is that if you are concerned that you are experiencing significant memory or thinking problems, the thing to do is to get a good medical evaluation so that your health providers can look into it and figure out what might be affecting your brain function. And if you want to know more about what I recommend, they do. based on published best practices and the work of geriatricians. I have a video about that as well, about what doctors should be checking. And you should also know that some of the methods I'm going to talk about today in this episode, for this episode, I was really thinking about, what promotes brain health and can prevent or delay decline. And the thing to know is that certain methods that I'm going to talk about today are less likely to work in people who are much older or who are already definitely having symptoms. And that's because the way that many of these methods work is by promoting the healing of the brain's neurons. And to do that, you need neurons that are still alive and are still capable of repairing themselves. And unfortunately, if people have very obvious symptoms of memory or thinking problems, if it's underlying neurodegenerative disease such as Alzheimer's or another condition, it's often by that point quite difficult to reverse that, although it's possible that some of these approaches can slow down people's decline, and often they do make people's quality of life better. So with that, let me now go into another related topic before I share my specific strategies for promoting brain health, which is why is emotional well-being important to brain health? And I wanted to speak about this a little bit because this is something that I feel was really not part of the teaching and conversation very much when I went to medical school, which was over 20 years ago, the role of emotional well-being. We sort of focus very much on how the body works, how the brain works. But I have come to find that emotional well-being, I think, is actually really, really important and is particularly important to brain health. I think it's important to the health of the whole body. So why is it worth thinking about emotional well-being? So similarly, one is so you can feel better now. But also, emotional well-being has been associated with less cognitive decline and with better cognitive function, both in normal older adults and in cognitively impaired older adults. So in those older people who do seem to have developed something like Alzheimer's or another dementia, I can tell you, we see this in real life all the time, that when they are feeling well emotionally, what's left of their memory works better, and a lot of their thinking processes work better. And when they are upset or stressed out, all of that works less well. We also know that emotional well-being has been associated with better physical health. I think it's both the effect directly on the body, and because when people are feeling good, it's easier for them to do things that are good for them, whether for their body or for their mind or for their spirit and soul. So the truth is that the brain is part of the body, and the mind-body connection is real. So I hope at this point we are on the same page as to why it's important to promote brain health and emotional well-being in aging. So let me now take you through my very top ways to do this. And so when I thought about this, I made a little list of everything that was important, and I decided to organize it into three key buckets. The first is to cultivate a positive attitude towards your own aging. Next, there is to do what is good for brain health, what we know is good for brain health based on a lot of research and clinical experience. And then lastly, there is to avoid what is bad for brain health, what we have reason to believe is not good for your brain cells. So let me now talk about each of these buckets in a little bit more depth. So first of all, cultivating a positive attitude about your own aging. So what this means is cultivating positive beliefs about your own aging and how it affects your life. So this really is about your perception of how aging affects your life, including your quality of life, your energy, your happiness, and your feelings of usefulness. And so in research studies, the way the researchers have often tried to assess this is by asking older adults questions like, do you feel that as you get older, you are less useful? And this is really important because a lot of really interesting, wonderful research has consistently found that more positive self-perceptions of aging have been repeatedly linked to better health and better outcomes. So not only are we happier when we have a more positive perception of our own aging, but we also tend to live better and live longer. And furthermore, there's been some recent really interesting research showing that when people have mild cognitive impairment, so that's the condition I was referring to earlier, when your memory or some other aspect of thinking are a little worse than expected for your age and education, but not so bad that you can't still manage your daily life affairs. So we know that people who have mild cognitive impairment, a certain proportion of them advance to dementia, but others recover. And so a really interesting research study found that people who had a more positive perception of their own aging were more likely to recover from mild cognitive impairment. So how does one do this? Now, you may be thinking, well, how are we supposed to be, positive about this if I have, lots of difficulties in my life right now, losing my independence or lots of health problems? And it's true that if you are in that stage of later life where you're facing a lot of those challenges, it's definitely harder to cultivate a positive attitude. But what we know is that people are often not feeling so positive about their own aging, even if they are in their 60s or 70s or even 80s. But even if they are at the point where they are older but haven't yet started experiencing really significant challenges to their ability to do things or to their health. So why is this and what can we do about it? So the challenge is that society tends to bombard us with negative associations with aging. We, especially in the United States, are quite, youth-centric. And so that means that many of us have internalized ageism, right? And that we think negatively of other older people and then of our own aging as well. The good news is that research shows that attitudes about aging can be improved. And so a lot of this work was done by Dr. Becca Levy. She is a PhD, I think, psychologist. I forget if it's psychologist or gerontologist at Yale, but she's done a lot of really wonderful in-depth research. She's also written a book about this topic, about people's age beliefs, how that affects their health, and also how we might be able to change them. So in a really interesting study she did, she found that when older adults were presented with subliminally presented positive age stereotypes, so that improved their physical function. So after learning more about this research, I've really come, and also after just seeing so many older people navigate the challenging part of later life. The past several years, I've done this especially through my online group programs where I support people who are helping a declining aging parent. So after just witnessing lots of older patients that I've worked with directly, families I've worked with directly, and families in the programs, I can tell you that it's often much better when the older person has a more positive attitude about their own aging. So how can we do this? So the place to start is to, first of all, I think it's important to realize that this is not something that we can kind of will and muscle into with, I'm going to just stay positive. That tends to not work very well. So I think what's most important is to start by just becoming more curious and aware of our own attitudes towards our own aging, and initially being really accepting of whatever you find, even if it's that you find that there is a lot of negativity or fear or dislike. I think it's actually really important to acknowledge and process those fears. That is part of how we can start to release them, and that is part of what can allow us to more authentically focus on things that we might be able to appreciate and maybe shift things a little bit. I think it's a really powerful practice to cultivate some acceptance because in our lives, there will be things that come down the pike that we are not able to change and that are going to be difficult and disappointing that we will have to accept. And then also gratitude for whatever is there, because there almost always is something to appreciate. I think it's also really beneficial to seek out positive aging role models. And I especially encourage people to look for positive aging role models who have made adaptations or are modeling interdependence. So we all occasionally hear about some amazing older person, the person who runs the marathon at 90, or older. And those are wonderful. I love those stories. And I think it's also really wonderful to see people who are less kind of exceptional physical outliers and more people who are managing to kind of make the best of things despite challenges. So a woman who's kind of a combination of these two. You might recognize this picture. This is Dorothy Hoffner, who made the news in October of 2023 for skydiving at age 104. And so this is her after her skydive. And I like that she's there with her walker, and still looks like, a frail older person. Now, she certainly looks younger than 104. I would give her a good 10 to 15 years younger. And she was certainly exceptional. There are very few people who are going to be skydiving at 104. But she's there with her walker. She was living in an assisted living. And I think she is just sort of an inspiring example of someone who still did a lot of things, even though she was in the stage of life that, we might describe as interdependence, where she did not live fully independently and still counted on other people to support her. So that's cultivating a positive attitude towards one's own aging. And so let me now share with you the things that I believe are good for brain health, the things to do more of. And so I'm going to start, still going on the theme of emotional well-being with number one, maintaining meaningful relationships and a sense of purpose. So this is another thing that I think was really not talked about much when I went to medical school 20 years ago, but that so much research has highlighted in the past 10, 20 years is the importance of relationships to people's physical well-being. And also mental and emotional well-being, and also the importance of a sense of purpose. So the way to do this is, first of all, think about how to cultivate and nurture the relationships that you do have, whether that is with a spouse, adult children, siblings, friends, neighbors, coworkers. Obviously, the closer the relationships, family-wise or in terms of longevity, the more important. And then I want to say also that I've realized over the past several years that we also all have a relationship with ourselves. And that is another important relationship to be mindful of and to cultivate with ourselves. So ideally, we are a good supportive friend to ourselves, but many of us are actually not so supportive to ourselves, might be actually kind of hard on ourselves or critical on ourselves. And that affects our physical health and emotional health as well. So in terms of how to do this, what I think can really help with this is, if you haven't already, spent some time on this, is to, consider getting some support with personal growth. So our relationships often get better when we work on ourselves and bring that to the relationship. There are lots of books about relationships and about ourselves that can help. There are, support groups. There is, getting therapy. There are lots of ways that we can improve those relationships, whether that's with ourselves or with people that we are close to or want to be closer to. And then another thing that's really wonderful for relationships and a sense of purpose is to find ways to contribute to others or otherwise maintain a sense of purpose. So this might look like offering care to a family member if you're able to do so. Volunteering can be really wonderful. If you are working, continuing to work is wonderful, or getting a part-time job, community activities. There are actually often certainly in metro areas and sometimes in rural areas, networks of people who volunteer to support older adults who need more support. I think that can be a really wonderful way to have a sense of purpose, to contribute. And it also means that later, when we reach the stage where we need some support from others, because most of us are going to go through a stage, again, of being interdependent in our later years, because the only way to get out of that is really to die very suddenly. So if we have volunteered and given, that often helps us have the networks and support so that when we need support, people are able and available to support us. So that's, one of the first things I wanted to share about what I think is good for brain health. And then kind of related, but not exactly the same thing, number two is to do things you authentically enjoy and bring you pleasure. So again, turning inside a little bit and asking oneself, what do I really like to do? What do I enjoy? And how can you make sure to be doing that? Whether it is, gardening or listening to music or reading. What are those things, and making sure that you are doing them, because sometimes what we are doing as part of, relationships and a sense of purpose, is meaningful. And there may be it may not bring us tons of enjoyment in the moment, or there may be additional things that we would enjoy. And there's, interesting work right now on just the way that when we enjoy ourselves, what it does to our brain, our body, our nervous system, that is good for our cells, to help them repair themselves, and for our body to stay well. And then also related to that, and also it's a bonus if you can do things you enjoy in community with other people, because then it's kind of a double benefit, right? Socializing with others and enjoying something. And then related to this is to do things that help you relax and reduce stress. So one thing that I did learn about in medical school, I just think didn't quite appreciate all the implications, but we all have a part of our nervous system that is not under our voluntary control. It is called the autonomic nervous system, and it has kind of two complementary sides. one side that is called the sympathetic nervous system that does all the flight or fight kind of reactions. So when your heart speeds up, either because you're excited or afraid or stressed out, or in an engaging physical activity, that is your sympathetic nervous system revving up. And the other side, parasympathetic, is the one that we call, rest and digest, right? That helps you like calm down, smooth down. It does actually like activate the digestion while, you are resting, restoring yourself and healing. So it turns out that modern life, especially in the United States, tends to keep a lot of people quite revved up, sort of overly revved up in the sympathetic side. And so many of us would benefit from just making sure we do things that bring out that other side where we relax and reduce stress, because that is actually when, cells tend to do more repairing and healing of themselves, and where I think the body can otherwise restore themselves. It's actually very interesting. The body in general needs a little bit of stress, and then it kind of activates itself and heals itself more after the stress, but it also needs the kind of downtime after the stress to finish restoring itself. So thinking about, how often do you feel relaxed in general, what helps you relax, what helps you reduce stress. And there are many practices that are specifically geared towards helping people tap into this more relaxed side, such as, various meditation traditions do this. Mindfulness does this. Something like massage, breath work, therapy can also, for people who are chronically like wound up, not relaxed, can help as well. So I think it's been underappreciated sometimes how valuable cultivating these things can be towards helping us maintain our brain health as we get older. So let's now get into some more, maybe traditional factors that are good for brain health. These are the ones that I think are actually really, really important, even though you may have heard of some of them before. So number 4 on my list, exercise. Yes, exercise. It is cliche, but it is amazing how the research just keeps showing over and over again how valuable exercise is when it comes to supporting our brain, supporting our bodies, also supporting mood, actually, while we are at it. And I've heard longevity experts multiple times say that if they were going to bottle up something, or pick one thing to do for longevity and for supporting cells, it would be exercise. So in terms of exercise, getting into the details, what I think is really important for older adults is to include all 4 key types. And one type that is really important. So when I was in medical school, they said exercise is good for people. But I feel like it's really in the last several years that I have seen more and more emphasis on strength training in particular. So exercises that actually challenge the muscles and help them get stronger. So this is also sometimes called resistance exercise, and it often involves weights. So it can start with body weight, so things like squats and push-ups. But once people get strong enough to do those fairly comfortably, you are supposed to add some weight or otherwise make the exercise more challenging. So that's a really important type of exercise. And I was not taught that 20 years ago. Other types of exercise to consider include endurance exercises, what's also known as cardio. And within that, I won't go into it right now. It'd be great to do an episode about it, but there are different types of cardio. So for instance, high intensity interval training has, some particular benefits. There are balance exercises that help practice the balance. That's probably good both for the part of the brain that manages balance, and also you'll be steadier on your feet. And there's flexibility, which is often also related to just maintaining mobility as we get older. So when it comes to exercising for brain health, I think it's always good to start off by asking yourself, what are some forms of exercise that I enjoy, and gravitating towards those. But regardless, I highly recommend strength training twice a week. I really do. Not just for the brain health benefits, and it does seem like it has brain health benefits, but it is probably the most useful thing that you can do to maintain mobility and steadiness on your feet. So a lot of older adults are sort of frailer and having more trouble moving through the world because they have gotten weaker. And strength training is really good at countering that and helping people maintain their muscle mass, which ends up being really important to keeping it easy for them to be doing all the things that they usually do or like to do or have always done, whether that's go up the stairs at their house or various other things, get in and out of the car easily. And then I think it's always nice to consider exercise forms that offer multiple benefits because many of them do. So for instance, things like yoga, tai chi help with mindfulness and help with that relaxation reflex. Whereas dance, especially if it's some form of social dance, that is socially and cognitively engaging. That's actually like a good, workout for the mind, keeping track of the steps, also for balance and for coordination. And then lastly, a word about walking. Walking is wonderful. Walking is a wonderful activity. You get outside, you can do it with friends. It's very practical. But what's really important to know, and I had a geriatric physical therapist say this to me years ago, walking is not enough exercise to maintain strength. And usually like barely enough really to qualify as cardio, unless people are fairly out of shape. So I know a lot of older people who are like, oh, I exercise, I walk everywhere, I walk all the time. And walking is great, but I would really encourage you, if you really want to promote your brain health, to at least add the strength training twice a week and to consider some of these other forms of exercise. Okay, moving on. What else is good for brain health? So next on my list is addressing cardiovascular risk factors. Cardiovascular risk factors, were traditionally thought of as the risk factors for cardiac disease. Cardiac means heart. So it was the risk factors that could lead people to have a heart attack or some kind of other heart problems. But cardio does mean heart, but vascular means blood vessels. And actually, it is very important that blood vessels support the heart adequately, but your blood vessels are also essential for supporting your brain. And so whatever is good for blood vessels is good for the heart and also generally going to be good for the brain. And what is bad for the blood vessels of the heart will be bad for the blood vessels of the brain. So what are the main cardiovascular risk factors to think about? The ones I especially think about, high blood pressure, high LDL cholesterol, diabetes, and what's called prediabetes. So this is also known as impaired glucose tolerance, people who tend to get their blood sugar kind of high when they eat, but not high enough to meet the threshold for diabetes. Also smoking, and along with smoking goes secondhand smoke and air pollution are also known cardiovascular risk factors. So that's, one reason to potentially try to keep the air in our cities clean, actually, to the extent that we can. Another known cardiovascular risk factor is obesity, also physical inactivity, also inflammation, right? And there are lots of different ways people can develop inflammation. It is thought for many people to be related to what might be going on in their gut. There's also a related phenomenon of oxidative stress. So this is when the mitochondria, the little kind of power packs of each cell, end up kind of stressed out and feeling unwell. And then unhealthy diet. And in a moment, I'm going to talk more about diet. So obviously, I could do an episode on each of these, for a fair amount of time, and I won't do it now. But if you would like to learn more about cardiovascular risk factors, I do have an article on Better Health While Aging about how to address them for brain health. And that can take you into a little bit more detail about these. So going on to what's good for brain health. Nutrition, right? So before here, I wrote unhealthy diets, is a cardiovascular risk factor, which raises the question of what is a healthy diet, a healthy, nutritious diet. So the way I think of a healthy, nutritious diet is initially I think of it less as what exactly is in the diet, like what are you eating and not eating, and more, can it achieve what I think are the most important results or goals of eating well. And for me right now, these are the following. So first of all, it's a diet that helps your body keep glucose, so that means blood sugar, inflammation, and your weight in good control. It helps foster a healthy, diverse microbiome in your gut. So this is another thing that I was not taught about in medical school 20 years ago, is the microbiome, the community of microbes in our intestines and in our gut tract. So back then, 20 years ago, they said, yeah, you have all these microbes and most of them aren't particularly doing anything. And some of them are, like C. diff. Well, what we found out since then is that all those microbes are actually very actively involved in our health. They are in constant communication with our immune system and with other aspects of our body going back and forth. And so it's important to have a healthy community in there, which means usually that it's more diverse. And so the right, kind of nutritious diet should foster the kind of microbiome that generally supports the sort of health that you want to have, as opposed to tending to make you sick or tending to increase inflammation or cancer in your body. A healthy, nutritious diet is also one that provides you with a variety of nutrients that your cells and your healthier gut microbiome need to be healthy and well. And then a healthy, nutritious diet is one that should minimize your consumption of toxins and of things that are not good for your cells, for your organs, or for your possibly for your microbiome. So toxins can be things like heavy metals, like the mercury in some seafood, could be pesticides, could also just be sort of additives and synthetic ingredients that are often, in fairly large quantities in packaged and industrial processed foods. Those are, toxins as well. So that's how I, define a healthy, nutritious diet. And then it's a bonus if it's the kind of diet that you can enjoy in the company of others, because eating with others is a pleasure. And actually in many of those, communities worldwide where people tend to live a very long time, I think in all those communities, people tend to have leisurely meals with, people, with others. So I think that's, a sort of additional factor to consider for the diet. So as you can see, or maybe it's not obvious, but what we are learning is that different people respond differently to different types of foods and diets. So there's probably not one, ideal healthy diet that works for everyone. I mean, there's certainly not going to be one that works for everyone. So if you want to eat a healthy, nutritious diet to promote, brain health and health otherwise, I think it's really useful to try to learn more about what works for your body to keep glucose, inflammation, and weight under control. Because there have been interesting studies done where they have sort of given a group of people all the same diet and then followed their blood sugar and other metrics and seen how people's bodies responded quite differently. And so that's probably about people's genetics and maybe even more about the bacteria in their gut and some other sort of lifestyle effects that are affecting how they process the food. So a healthy, nutritious diet is going to be individual for each person. And it probably also changes throughout our life, actually, that as we get older and our bodies change, what might be the right diet for us, when we're in our 70s might be quite different than when we were in our 30s. But there are some general principles of what seems to be a nutritious diet for most people most of the time. And so in general, first of all, lots of vegetables, greens, fiber, fruits, beans, lentils. These are the foundation of supporting a healthier microbiome, the gut bacteria. So this has been shown over and over again. Now, it's true there are individual people who can't tolerate certain foods, right? And so if you are one of those, then that's who you are, and you're going to eat less of those foods that you can't tolerate, or maybe work closely with somebody who can help your gut transition. I think sometimes it's possible to help people learn to tolerate some of these foods. But that's generally a mainstay. Also, in general, we want to minimize added sugars, fast food, trans fat, and processed food, especially processed meats. So sugar tastes delicious and is really not necessary otherwise for the body. And there's quite a lot of evidence that in many people, it ends up causing problems managing their blood sugar and otherwise causing, negative health impacts, anything from a little bit negative to a lot negative. So thinking about how to minimize added sugar can help. Fast food often just contains a lot of stuff that is not great for most people's bodies. Trans fats have, been associated with negative health outcomes, and so has processed foods, especially processed meats. Next, in terms of what's, usually in a healthier diet, I recommend being careful about simple starches. So refined flours, most sweets, especially if your blood work suggests problems managing your blood sugar. And then there are some additional foods that are likely beneficial. So these include nuts and seeds, especially flax seeds. These are sometimes called healthy fats. Avocado also usually falls under the healthy fat category. Foods with polyphenols, such as olive oil and berries. Cocoa and tea, especially green tea, contain flavonols and other compounds that seem to be good for helping cells and organs. Seafood, especially oily fish, high in omega-3 fatty acids. Fermented foods. There's, research suggesting that fermented foods help, again, foster that diverse, healthy microbiome. So this, fermented foods include yogurt, but also things like sauerkraut, kimchi, kombucha, kefir. And then in many, cultures locally, they have all kinds of fermented foods. And then lastly, I would put on the list high quality protein. There is a lot of data. I don't know that the protein is all that necessary for brain health, but there's a lot of data accumulating that eating enough protein is really important to help older adults maintain muscle mass as they get older. And what you kind of want is the combination of enough protein intake along with doing these strength training exercises. So I put protein there just as part of what I think is a healthy, nutritious diet for older adults in general. The recommended daily allowance is still 0.8 grams per kilogram per day, but there are quite a lot of people who feel that that is too low, especially for older adults who need to be really proactive about maintaining their muscle mass and ideally maybe even increasing it, because the nature of the body and aging is that if you don't do anything in particular, we tend to lose muscle mass as we get older, and that process accelerates after age 60. So I think, aiming for at least 1.2 grams per kilogram, which in pounds would be 0.54 pounds per body weight, and going up to 1.5 should be grams per kilogram per day. So 0.68 grams per pound of body weight would be a good idea. And animal protein is what is very effective. It's very easy for the body to absorb and digest. So, fish, poultry, eggs, and then some people, of course, choose to eat red meat. There's a lot of debate about, the health impacts of red meat. It might definitely depend a little bit on how that animal was raised and what they were fed for that. So those are the things I think about when it comes to a healthy, nutritious diet. Moving on to other things that are good for brain health. Number 7 on my list is to treat hearing loss early with hearing aids. So there has been a lot of research linking untreated hearing loss to declines in brain function. And this is probably because, first of all, untreated hearing loss definitely interferes with communication and social activities. And we know that when people become less socially engaged, that can potentially accelerate cognitive decline and often is not so good for mood and emotional well-being. So the untreated hearing loss, we do see it associated with cognitive decline and with developing dementia. So I think it's important to have your hearing checked sooner rather than later. There are a lot of people who put off dealing with their hearing. The thought of hearing aids makes them feel like an old person or feels like a pain. And it's true that historically hearing aids have been quite expensive, although now we're going to have more access to over-the-counter hearing aids, and I think there'll be, more affordable options. But it's important to check sooner rather than later because hearing loss gets harder to successfully treat as it gets longer lasting and more profound, especially if the person has also experienced memory loss or other obvious cognitive decline. So why is this? So your brain has a part of it that is dedicated towards interpreting the sound signals that come into your ear. And so when your brain, first, when the sound is garbled, your brain, basically has to work really hard to decipher what is being said. It's like, any of us, if you're hearing people through a loudspeaker where it's really warped and distorted, you're like, what? So initially, it's a lot of work to decipher it. And eventually, people kind of give up on trying to decipher it, or the brain gives up on trying to decipher it. And then that part of the brain will either wither away or those neurons will just get busy doing something else. And then if people have developed memory loss or other obvious signs of cognitive decline, so as I was saying, when people have obvious memory loss, they're obviously repeating themselves or not remembering something or getting confused about things, or, I won't go through my list of all the common symptoms right now. Again, at that point, they usually have had a lot of neurons die, and they're actually using everything they have to try to stay afloat. And they've reached a point where it's very hard to learn new things. So the thing about hearing aids is that when the sound is corrected through hearing aids, the brain has to relearn how to hear. So getting hearing aids, one of my colleagues who's an expert in this was explaining to me that it's not like putting on glasses where right away you get the right prescription and people can see clearly and it's like, wow. It's actually that they have to sort of relearn how to process the signal. And so a brain that has already experienced a lot of damage from neurodegeneration or small vessel disease has difficulty doing that. And so I think the best is to get hearing checked sooner if you have any concerns or earlier in life, and to not hesitate to get it treated with hearing aids. The studies are going on right now to see if proactively, if you treat hearing loss with hearing aids, does that actually change when people get dementia or not? But anyone who has been declining from a dementia process will struggle more if they're also struggling to hear. So I think it's a good idea to treat hearing loss. So those are my top things that I think are good for brain health. So let me now switch to the next bucket and talk about what is bad for brain health. So first of all, again, on the emotional well-being side, I'm going to put these three together. Chronic stress, untreated depression or anxiety, and then social isolation and loneliness. And I put these three together. Now, they are not all the same thing. However, they tend to have a lot of overlap and a lot of interactions with each other. So one of them can bring on one of the others or both of the others. It can be hard to treat one without treating the others. They really go together quite a lot. And the thing about addressing these in people is that I think often these are best treated with a combination of social connection, lifestyle changes, and non-drug treatments. Now, it may be necessary to also consider medication, especially when it comes to certain forms of depression or really severe anxiety. It may be necessary to consider medications. But what you want to do is, even if you are going to use medication or considering medications, I highly recommend always thinking about how can we bring in social connection? How can we bring in some lifestyle changes? And are there other non-drug treatments that would be beneficial? And also remembering that treating the others can help treat one of them. So people who are depressed often benefit quite a lot from help with whatever is creating a lot of chronic stress with them and relief from social isolation and loneliness. Also on the topic of chronic stress, there is definitely a role, if chronic stress is a major issue for somebody. There are ways to improve people's resilience, to teach them to manage the stressor more effectively, to help them process what the stressor is bringing up for them in therapy. And those things all help. But also what I would say is that often to really make a significant difference, people need a reduction in their exposure to that stressor. So if that stressor is, caring for somebody else, reducing like the load, if the stressor is a very stressful workplace, because, for instance, if we are to think about health providers went through a lot of stress during the pandemic. Now, lots of people working went through a lot of stress in the pandemic. So it was not just health providers, but, there was this trend for a while in the workplace to create all these employee wellness programs that would help them, manage the stress better. But what a lot of people need is actually they're being given too much stuff to do in too little time and without enough kind of rest period to restore themselves. And that is ultimately what they need. So I think that's something important to keep in mind. And then also just to not underestimate social connection. So even things that are stressors affect people less when they can do them in fellowship with other people, or when they feel like their difficulties are seen and validated and witnessed by compassionate others. So again, the value of social connection when it comes to brain health and well-being, I just think cannot be overstated. Other things that are bad for brain health. So next on my list is not sleeping enough. Now, it's true that as people get older, their sleep tends to get lighter and more fragmented. They tend to go to, be sleepy earlier, so they don't sleep as long in the morning. Those are all real factors. And there is a lot of data that when people are really not getting enough sleep, that tends to negatively affect brain health, because adequate sleep is key to the brain repairing and maintaining itself. Now, many people, because they're having difficulty sleeping, if they mention it to their doctor, are given a pill for that. And that can help people feel like they're sleeping more. But the research does suggest that, this kind of chemically induced sleep may not be as good. The brain doesn't actually go into the same internal cycles with the chemically induced sleep. So if you are having difficulty sleeping, I think it can be good to think about, what are ways to manage this without having to rely, long-term on medication, because sedatives and sleeping pills have been associated with some cognitive problems. And I think it's not a good long-term solution. So also, if you're having difficulty sleeping, one should always start by remembering that alcohol and caffeine interfere with sleep. So if you're not sleeping well and you have been drinking wine or something else in the evening, trying to reduce that or cut that out might help. Caffeine after 12 p.m. can often interfere with people's sleep as well. And in general, it's going to be better for the brain to treat primary insomnia. So primary insomnia means sleep difficulties that are not because of another medical problem like sleep apnea or pain in your legs or breathing difficulties, or, there are sort of a variety of conditions that often cause sleep difficulties in adults and in older adults. So if it's primary insomnia, it's really likely better for the brain, especially in the long term, to use non-pharmacological approaches. These include things like stress management. So if the sleep difficulties are related to an ongoing stressor, addressing that, sleep hygiene techniques like having a consistent bedtime and wake up time, being off screens, keeping the room, cooler at night, not drinking alcohol in the evenings. Many randomized controlled trial studies have shown that cognitive behavioral therapy for insomnia is effective, including in older adults. I think soothing audios are kind of an underestimated, underused approach as well. So if you're not sleeping well, please don't panic or worry too much about your brain health. I mean, sleep does change and tend to get lighter with aging. So you don't want to stress about it because that tends to make sleep worse. But I do recommend sort of looking to get assistance and addressing it because I think it's worth it, especially in the long run. And so if you're having sleep difficulties, always start by getting medically evaluated to make sure that it's not something like sleep apnea or something else that's medical, because there are treatments that are available that can be specific to certain causes of sleep difficulties. And if you want to learn more, I do have an article about sleep problems in older adults on Better Health While Aging. Next on the list of what's bad for brain health is brain-slowing medications that geriatricians love to hate. So I won't go into these in depth. Again, I have 2 videos that are about them, but generally sedatives and tranquilizers, sleeping pills, and then anticholinergic medications. So these are medicines that, interfere with the action of acetylcholine, which is, first of all, a major neurotransmitter in your brain that your neurons use to talk to each other. That's why when people have Alzheimer's, we give them a medication that tries to boost acetylcholine in the brain. And also acetylcholine is the major neurotransmitter in that parasympathetic nervous system that I was describing, the one that does all your rest and digest throughout your body. That's why when we block it with a medication such as, Benadryl, that's probably the most commonly used anticholinergic medication. That's why people get dry mouth and can get constipated from it. And so there are many medications, both over-the-counter and prescription, that are anticholinergic and that we generally, discourage to promote brain health in geriatrics. Now, this is not a medication that I would avoid for brain health, but since people often ask me about it, what about statins for cholesterol? So a while back, somehow there were media stories and a lot of people got the idea that statins are bad for memory. So statins are medications that are commonly prescribed to lower cholesterol, like atorvastatin, Lipitor, and simvastatin, the brand name there is Zocor. So what about those? So this has actually been studied quite a lot because we've had a lot of very large randomized studies of people where cholesterol medication statins were studied. And what's shown is that statins definitely reduce cardiovascular events. There's just no doubt about it. And it's a meaningful reduction, especially in people who have already had a cardiovascular event, people who have already had a heart attack or a stroke kind of thing. So I think it's definitely worthwhile for those people. And in those big studies, there has not been a clear effect noted on cognition. Now, there are certainly lots of individual reports of people who seem to be affected in that way. So I think it's more of an idiosyncratic reaction that some people experience. This is not to say that statins are totally risk-free. No medication is totally risk-free. Don't take it unless there's a really good reason to take it, such as you've already had a heart attack or a stroke, or if your doctor tells you that for other reasons, they believe that you are at particularly high risk for a cardiovascular event. Because cardiovascular health is so important for brain health, I think there is a net benefit for brain health in people who are at high cardiovascular risk. So that would be what I would say about statins. Next on what might be bad for brain health. So I didn't give these a number, but I think they're worth mentioning. So first of all, alcohol. So alcohol is definitely bad if it is in large quantities. Heavy chronic use damages the brain for sure, no doubt about it. And also when people are intoxicated, they can fall, especially if they're older. That can lead to head trauma. And there is research that, head trauma can accelerate cognitive decline in older adults. In younger people, puts them at risk for cognitive issues later in life. or can affect them cognitively in the short term as well. So what's a little more unclear is, what are the implications of, mild to moderate alcohol use, especially regular use. There are some people who think no amount of alcohol is 100% safe, but also, the Mediterranean diet, and in the Mediterranean or in these, parts of the world where people live a long time, people usually drink wine, often, every day. So I think it's, reasonable to say that light use, which in the United States is defined as 1 drink per day for women and 2 per day for men. Light use is probably safe enough for many people, but you certainly want to avoid heavy use. And again, drinking alcohol in the evening can affect sleep, so you want to be careful about that as well. So next, there's the question of cannabis. So in recent years, people have asked me a lot about cannabis because we're kind of going through a expansion of cannabis use in the United States. It is being decriminalized in many states. We have the baby boomers getting older, who had used it earlier in life and are bringing that into later life. And so people have started to ask me, is this safe for brain health? What do I think? What should they know about it? And the answer is we don't really know. We don't know because we don't yet have the research to know what are the long-term implications, or even really the short-term effects, because cannabis, as you may know, also right now comes in a wide variety of preparations, right? And of different strengths and concentrations and varieties. So what's clear is many people enjoy it for various reasons. And it does seem to help some people with certain symptoms, whether that is with sleep, with, anxiety, with headaches, with, nausea, pain. Those are some of the symptoms that I've heard people using it for. So it seems to be benefiting, or people seem to be getting a benefit out of it, but we really don't know what the impact is on short-term and long-term brain health. Now, there is some research that I think is potentially relevant. And so I just wanted to briefly speak to this study. I don't know how we say this, Dunedin. It's a city in New Zealand. But this study is a longitudinal study that has been going on for over 40 years, where they took a cohort, I think it was about 2,000 people, I believe, and they enrolled them, I believe, shortly after birth, certainly very early in life, and kind of gathered lots of information about them, and then have continued to check back in with that group over their life. And this group is now in their late 40s. So when they did, an evaluation of the group at age 45, they actually did do some cognitive testing and also some MRIs to scan the brain. The group had also gotten an IQ test earlier in life, and I believe they repeated that. And so what they found is that long-term cannabis use was associated with cognitive decline and smaller hippocampus size. So hippocampus is the part of the brain over here that manages memory, that often is fairly early to be affected in Alzheimer's disease, and is why often with Alzheimer's disease, people start off with difficulty with their memory. So in this study, they defined long-term cannabis use as, I think it had to be at least weekly, and also that people had been using it regularly at one of the previous interviews earlier in their life. People who were sort of considered occasional users, there was not, an association with cognitive decline seen. So now, how to use this information in terms of older adults right now? I mean, maybe cannabis has more of an effect if you were using it a lot as a teenager, and less right now. We don't really know. But I think based on this, I would say, be careful about regular use unless you really need it to manage symptoms. That would be my suggestion for right now. Probably occasional use is okay. And we really don't know what would be the impact or implication of ongoing use, especially if, people are using it quite regularly through their 60s, 70s, 80s. So let me now just move on to a couple other things that I'm often asked about, which is cognitively challenging activities and brain games, and then the role of supplements and vitamins. So first of all, cognitively challenging activities and brain games. So people sometimes want to know, well, how important is it to do the crosswords, Sudoku, or maybe, a brain game? So what do we know so far? So first of all, one thing we know is that it's definitely clear that early life cognitive work, so how much educational achievement is usually the proxy for that, is linked to more what's called cognitive reserve. So basically, the more you do with your brain early in life, through school, challenging career, the more kind of strong your brain gets. And so then later, as it starts to, taper off in later life, either because of age-associated normal declines or even an abnormal decline, it takes longer before people, start noticing that they are having difficulty. So that's early life educational achievement. But it also seems that, that first of all, as people get older, provided their neurons are reasonably healthy, they can still learn things and work things and form new connections. And also that it's important to use it. If you don't use it, you lose it. That's very real when it comes to the brain and to the body. So I think it is actually it does seem fairly clear that cognitively challenging activities force your brain to work harder than usual. And so again, if your neurons are reasonably healthy and able to kind of get stronger, that's probably good for them. So, but the activity does have to be making you work harder than usual. So that might be learning a new language or an instrument or, social dancing. If you do the crossword all the time, the crossword generally gets easy for those people. And so then it's not bad to do it, but you're not challenging the brain. So just like you want to challenge the muscles, and often that means increasing the weight or difficulty, the brain, it needs to feel tiring when you did it, because this promotes neuroplasticity and probably promotes brain health. Now, in people who, have signs of abnormal cognitive issues, again, if their brain cells have gone sick, have died, there is evidence that doing some brain training can help them, but I think we have to be more careful about not pushing them too much, because all those poor neurons are, often working at capacity at that time. So then there's the specific cognitive training brain games. So those have been studied in research studies. They're often very carefully designed games that work a certain cognitive skill. And the research finds that cognitive skill that's trained by the game generally does improve, that improvement often lasts for quite a while afterwards, sometimes translates into another benefit in terms of people's ability to manage their daily life activities or something practical. So it is very promising. The difficulty is that, as far as I can tell, the commercially available brain training games, are not as effective, right? Have not been shown to be as effective. So I think the question is less, could this be valuable, and more, where do you want to spend your time? So in my opinion, it's really important to, first of all, keep using your brain, right? So if you are one of those people who in later life is using your brain a lot less than in midlife, that is not ideal. So ideally, you would keep using it, as much as you did earlier. So if you have retired and are no longer working, what else can you be doing that gives you kind of a comparable level of, mental stimulation and effort? So it doesn't have to be learning something crazy new, but at least doing, a comparable level. And then if you are up for it, it can be good to mentally challenge yourself, especially if you enjoy it, especially if it's something that you can do with, other people, or otherwise get a 2-for-1 benefit. And I would say there's no evidence that cognitively challenging yourself is more effective than exercise, adequate sleep, social connections, or stress management. In fact, I would say it's more important to prioritize the exercise, the sleep, if you can. Again, it can take some time to learn to sleep well without pills, but I think it's worth it. The social connections and relationships. And I think the best bang for your buck are cognitively challenging activities that involve exercise, socializing, or music. I think that's better than brain games. And then we have vitamins, supplements, and brain health. So, I've had a lot of comments in response to my videos about medications and brain health that have asked me, what vitamins, what supplements, what about this, what about that? So let me tell you what I know about it so far. So right now, the party line in medicine is that there's no particular vitamin or supplement that we can recommend. And that's because when we do get around to doing randomized trials, they mostly don't find an effect of various vitamins and supplements on brain health. And certain vitamins and supplements have been studied quite a fair bit. These include antioxidant vitamins, omega-3s, and vitamin D. So I think it is plausible that supplements can help some people. So despite, the randomized trials, I think it is plausible that supplements can help some people. It may be a question of figuring out, which people or getting the right dose. But before you go, the other thing to keep in mind when considering supplements is that we have a real problem in the United States with our ability to access quality supplements, because in the United States, the production is not carefully regulated. And so the quality is highly variable. There have been studies done where they, take commercially available supplements or vitamins, put them in the lab, and there is not the amount of active ingredient that was promised, or it is tainted with some other compound, sometimes something toxic. So, there are real issues there. And that is part of why I hesitate to recommend vitamins and supplements. Also, I've noticed that, especially when it comes to brain health, a lot of people really want to protect their brains, which I get. And selling brain health supplements is big, big business. So I think it's important to just be cautious when it comes to supplements for brain health. And then I also want to share a little bit about some of the recent research that has been done, because I was listening to somebody else's podcast and they were talking about vitamin D, all the benefits of vitamin D. Vitamin D is a very interesting, molecule, but they didn't mention the relevant recent clinical research. They just talked about all this basic science research related to vitamin D. So important recent research. There was actually a very large randomized trial completed in recent years that studied vitamin D and omega-3. It was called VITAL. The initial results were published, I believe, in 2019. So they took 25,000 healthy older adults, their mean age was 67, and randomized them to get 2,000 international units of vitamin D or fish oil capsules or both. And then there was placebo. So everybody got 2 pills. You just didn't know if your 2 pills were both active, both inactive, or only one of them active. And they followed him for a median time of 5.3 years. And the key outcomes they were looking at were cardiovascular disease and also cancer. And they found that supplementation did not seem to have an impact. Now, maybe if people were less healthy, it would make a difference. We don't know, right? But this was still, I think, noticeable, because certainly if we randomize a large number of older adults to blood pressure treatments and get people's blood pressure down, you definitely see actually a reduction in cardiovascular events. That was done in the SPRINT blood pressure trial. Another study published in 2020, it was called Do Health. These randomized trials like to have a catchy acronym. This was much smaller, but people were older, a little over 2,000 older adults, mean age 75, randomized to a combination of vitamin D, fish oil, strength training, or placebo, and treated for 3 years. And there was not a difference, with these combinations for cognition, fractures, blood pressure, or even physical performance. And I can't really explain that, because I would have expected the strength training actually to help with physical performance, and it certainly has helped in other studies. But mostly I included this for the information related to vitamin D and fish oil. And then more recently, there was a study, Cocoa and Multivitamins Outcomes Study, COSMOS. So the original COSMOS had quite a large group of people. People got either a cocoa extract or a multivitamin or both or neither. And again, the outcome of interest was cancer or cardiovascular disease. And then there were some sub-studies that were done specifically to look at cognition. And there were 2,262 in Cosmos Mind. They had cognitive assessments by telephone as part of the follow-up. And then 353 were in a cognitive clinic subcohort. And they were followed for, I want to say it was 3 years. I forgot to write it down. So what Cosmos found was that the daily multivitamin was associated with better cognition and memory. There was also one aspect of their findings where the cocoa extract had some effect on cardiovascular outcomes, some small improvement, if I remember right. But the multivitamin was associated with better cognition and memory, and this was kind of comparable to delaying, cognitive decline by 1.8 years. So there is that. So based on that, I would say I don't like to specifically recommend vitamins and supplements at this time. I don't have a strong recommendation for them. I do think it's reasonable to, first of all, take a daily dose of vitamin D, 1,000 international units, and a vitamin B12. While we're at it, vitamin B12 does affect neurons, and vitamin B12 deficiency can affect nerve function. I lean towards a daily dose of those two just because it's so common for older adults to become deficient in those in later life, and because those doses are safe, and they, I think it should be reasonably possible to get something of reasonable quality. I think it's also reasonable to consider a high-quality multivitamin. I believe in Cosmos, they use Centrum Silver, so not even anything fancy, and a high-quality omega-3 fish oil supplement. And I say the fish oil because even though those big randomized studies were negative, a lot of experts in longevity, in memory, I'm thinking of one particular expert who has done Alzheimer's prevention for years and is, constantly digging into the data. They are all convinced of the benefits of omega-3 fish oil. So it might be that as we do the studies, it's never going to pan out, but not dangerous. I think, usually the burden is to the wallet, right? to paying for this for years on end, especially if it's a high quality supplement. But if I had to pick an additional one, I would probably pick that one. And what's most important to know when it comes to vitamins and supplements is that it's almost certainly better to focus on improving what you eat and getting vitamins and minerals through a nutritious diet rather than focusing on pills and supplements. So especially vegetables, beans, fruits, nuts and seeds, healthy fats, because you cannot out-supplement a lousy lifestyle. So you can't compensate with supplements for not getting much exercise, for sleeping very badly, for, what you are eating, and for your emotional health. And in fact, there have been randomized trials of multi-component lifestyle interventions. So this is when they randomize people to get a whole package that addresses, cardiovascular risk factors and exercise and other things. And those have actually helped people maintain brain health. So the results are better for that kind of multi-component lifestyle change than it is for any particular supplement in general. So to recap all of this, in short, what I believe is good for brain health, first of all, tending to one's emotional well-being. So promoting emotional well-being in aging through a positive attitude towards your own aging, cultivating that, working to cultivate that, meaningful relationships and a sense of purpose, doing things that bring you pleasure and enjoyment, doing things that help you relax and reduce stress. And then really important is exercise, strength train twice a week, plus include some cardio, balance, and flexibility. Address cardiovascular risk factors, such as high blood pressure, LDL cholesterol, blood sugar, smoking, etc. Eat a healthier, nutritious diet that keeps your glucose, inflammation, and weight in control and fosters a healthy microbiome. Treat hearing loss early with hearing aids. Get enough sleep. Keep using your brain as you age, and as a bonus, challenge it to learn new things. And then you want to avoid or minimize what's bad for brain health. So those include chronic stress, especially if you're having difficulty managing it, untreated depression or anxiety, social isolation and loneliness, not sleeping enough, brain-slowing medications, excess alcohol, and possibly frequent cannabis. And now, I just want to say a few words. What if you're here not only to learn about how you might promote your own brain health, but you're actually worried about someone else's brain health, like a parent or a spouse or a sibling or a friend? What if that is your situation? And I say this because I have a lot of people in my programs who are there because they are worried about somebody else's brain health, or who first found me because they were so frustrated by the fact that their parent or loved one wasn't, eating well, or wasn't exercising, or wasn't doing, the good things. So what you should know is it's great to help people find good information. It is one of the benefits of having friends, family, and people who care about us. And it's extremely hard to make people make these changes if they don't want to. It's especially hard if they are having some memory or thinking changes. But even if they're not, it's hard to make people change. So be very careful about trying to nag people to do this. I've had people come to me who are just so upset that their parent in their late 80s is not doing the exercising and eating all the right things. And first of all, at that point, I'm not sure how much changing what you eat will make a difference. Exercise generally helps. At that point, I would say what really helps if people are older and actually have symptoms is exercise, social connection, enough kind of like of the right kind of social and physical and emotional stimulation. Those are the things that are most important. Sleep is great if you can. Sleep often changes as the brain changes and can be very hard to manage. So yeah, you have to be very careful about nagging people to make these changes. So instead of nagging, try first of all modeling the changes in your own life, especially if you're concerned about somebody who otherwise has their memory and thinking is okay. And you can consider also talking to the person and listening to them and really trying to learn more about their motivations and hopes and fears when it comes to their own brain health or their aging. So to share some final thoughts, there is often no quick fix for this, right? There is no quick way to improve our attitude about our aging, our relationships, our lifestyle. But I think it is really, really worth it when it comes to our well-being, our brain health, and our physical health. So I want to encourage you to take some steps forward on this, unless you're already doing all the things I talked about and not doing all the things I talk about. I want to encourage you to ask your health providers for assistance, especially when it comes to cardiovascular risk factors. And be sure to ask about non-pharmacological treatments, especially when it comes to mental health issues. I mean, the research has shown that for mild to moderate depression, therapy is generally as effective as medication. Now, both of them together can be even better, but if you don't ask about non-pharmacological treatments, often in modern American medicine, you are just going to get the prescription. Same goes for sleep, stress. There are often non-drug methods that can be better for you in the long run. I want to encourage you to look for support in making changes. It is hard to do these things on our own. So can you buddy up with a friend and be accountability buddies for each other? Can you find a group program? Is it, an option to hire somebody as a coach or someone to work with you? Because the payoff, for your health later on might really be worth it. And lastly, I want to say there's no known upper age limit for benefiting from this, especially when it comes to people who, again, just have normal age-related changes so far to their memory and not more. There's no known upper age limit to benefit from exercise, from socializing, from more emotional well-being. Because in the end, nothing affects our life more than our emotional well-being and our brain function. So I hope you'll start wherever you start. Small changes and persistence can take people a long way, or try something again if you've tried it before and it didn't stick the first time. And when in doubt, if you're not sure where to start, I think exercise and socializing is always, a good place. So with that, thank you so much for watching. And if you found this video podcast helpful, if you're here on YouTube, please go ahead and subscribe. It helps more people find the channel. If you have been listening to the audio version on the podcast feed, come and take a look at the video if you get a chance, if you want to see my key points being displayed on the screen. So thank you again, and I look forward to seeing you all again on a future episode of the Better Health While Aging video podcast.